Hello, my name is Caitlin Gross, and today I will be talking to you about hazards in nursing. There are many different hazards in nursing, but the most hazards come with patient contact. Just because you don't know what kind of germs or diseases they have. To protect staff, we have personal protective equipment, or PPE. PPE has evolved over time with our medical technology, and as medical technology advances, new diseases come out, new germs are spread. PPE changes to meet the requirements to minimize staff and patient infection. The question is, are some of these PPEs able to protect nursing staff? It's time to change some of the materials that some of the PPE is made out of to better protect nursing staff and patients. Some type of PPE includes gowns. These yellow gowns, as pictured, are very porous, paper thin. These gowns would be used for when a patient is on a certain type of precaution. You would have to, bare minimum to walk in the room would be this yellow gown and gloves. Sometimes a mask. It just all depends what precaution the patient is on. These gowns, if you've ever worn one, very porous. If you wear them around body fluids and body fluids gets on you, it will soak through this gown and get on your skin, your clothes. Whatever is underneath this gown will be drenched. Another form of PPE is gloves. These are bare minimum to protect nursing staff and the patient. Anytime nursing staff comes in contact with a patient, they should have gloves on. Again, this is bare minimum PPE that should always be worn. Another type of PPE is masks. There are many types of masks. Most common is the N95 filter respirator. Somebody would wear a mask like this if their patient was on droplet precautions. So this mask and gloves would be bare minimum PPE needed to walk in that patient's room. Another type of mask is a disposable respirator. These respirators can be used for many precautions. They're used a lot in hospitals. Another form of PPE is eye protection. We have eye protection with a mask, which we call a full face shield, and there's also goggles that serve as eye protection. So what happens when this PPE fails? When this PPE fails, the nursing staff is more at risk. They have a greater risk for contracting or being exposed to dangerous or fatal germs, diseases, anything of that nature, because the layer of protection the layer of protection that staff has now ripped, torn, fell off, whatever the case may be. So staff is not as protected as they would be if this PPE does not fail. A prime example are gowns like this, yellow gowns. I put a close-up picture so you could see how see-through and porous they are. If you walk into a patient's room with this gown on and there's bodily fluids, first off, you're wearing this gown because the patient's on some type of precaution. Second off, if there's bodily fluids and you have this gown, there's probably a precaution with the bodily fluids. But if this gown is on, whatever bodily fluid you squirts up in the air, or whatever the case may have you, it is going to get on you. It is going to seep through this paper thin, very porous gown, and it will get on skin, clothes, whatever's underneath it. So what should the gowns be made out of? With any material that is less porous. The gown that is shown here, this blue gown, it is slightly more heavy duty. It is worn more in surgical settings, as you can see, and it better protects staff. It's not as porous. It takes a lot more to infiltrate the gown and affect the staff member. So, many questions that could be asked. What happens when these gowns are soiled? Well, if it's soiled, staff would take the gown off and place it into a biohazard bag. When the gown is put into a biohazard bag, it will be thrown away with the biohazard trash. But if the gown is not visibly soiled, the gown could then go to a commercial washing machine and dryer to be washed, dried, and sanitized. Then it can be reused. This may sound a little weird, but this is also how hospital linens are cleaned and redistributed to new patients. How could changing the material some PPE is made out of be beneficial to nursing staff and the community? Changing the material some PPE is made out of will better protect the staff from any kind of potential diseases or germs. It may not seem like a lot, but it could also protect the community by many ways. If the PPE fails and in fact infects the staff may not even know they were exposed and unknowingly take it home to their family. Say the staff member has a little baby. The baby's immune system may not be up to par like ours is, and it could be fatal for the baby. Or the baby could then take it to daycare and be a carrier, and now everybody in the daycare is exposed to that new germ or disease or whatever it may be. This is the chain of infection. Having more durable gowns and PPE made out of more durable materials could break this chain of infection, and it could decrease the infection rate from person to person. So in summary, there are many types of PPE. Some PPE needs to be made out of better material, the yellow gown specifically. It will not only protect nursing staff, but others, and it could change the person-to-person infection rate, like I said. Please be the positive change. Let's come together and make this change for you, me, and for our community.